What's going on, guys? Joe here again. Wanted to touch base with you for a quick second about home health nursing. In a previous video that I'll link up here, I talked about the 9 highest paying jobs for nurses depending on what degree you hold. So if you haven't seen that video already, click the link up here at the top and go check that out. We'll wait. Okay, no, we're not going to wait. Wanted to dive in a little deeper today and talk about what a home health nurse is and some of the things you can anticipate if you're looking into that kind of profession. So the first thing I want to do is I want to review the schooling necessary for a home health nurse or an ADN RN, and I want to talk about the income you can expect on a national average for home health nurses. Okay, so the schooling required for a home health nurse or an associate's degree RN is essentially 1 to 2 years worth of prerequisite courses and a 2-year nursing program in order to have the opportunity to take your NCLEX, which is a national licensure exam, and be able to become an RN. Now, once you do that, one of the things that you can go into once you're a practicing nurse is home health nursing. In home health nursing, on a national average, you can expect to make about $65,000 a year, which is a great income. And it's definitely going to depend on where you live in the United States. So if you live in an area like California or New York or some of the other metropolitan areas where the pay is a little bit higher or a lot higher in some cases, you can expect to make more money. Always consider the cost of living when you're considering the income from whatever source you're considering it from. So you can't compare, for instance, Texas and California because the cost of living in California is substantially higher than the cost of living in Texas. So if you're going to compare them, you can't do it without considering the cost of living in those states. All right, so let's jump into what a home health nurse does. So the first thing I want to mention is there are a ton of things home health nursing can comprise of. It can involve so many different things. There's no way I could cover every single one of them in this video. So if you are a home health nurse or you know about a field in home health nursing that I haven't mentioned today, please comment down below. Let us all know what your experience is and some of the options you may have seen. So the first thing I want to talk about is that I've basically broken down what you can do in home health nursing into 3 main categories, okay? And we're going to go through each of those categories right now. So the first category I want to talk about is personal care or companionship type home health nursing. In a lot of situations, families will pay for a nurse to facilitate essentially accompanying their loved ones with some of the activities they would do on a regular basis. These people may be fully capable of taking care of themselves. There just may be a growing concern as far as, taking care of their medication on time, making sure that they're not in a depressed state or in any situation where maybe there's something happening that the family who doesn't have an opportunity to be there hands-on all the time might be missing. And essentially what you're going to be doing is helping with general activities of daily living, not necessarily because the client is unable to do those things for themselves, but simply because it's safer to have somebody there with them. You'll also be riding with them places, taking them places, just kind of having that relationship with those people and growing to your client's needs, right? So you're going to be meeting your client's needs wherever essentially they need them. So a couple pros and cons to this that I've seen in my research. The pros being, obviously, you have the opportunity to really develop a strong relationship with your patients or clients. A lot of nursing positions out there are so fast-paced that they don't allow you the opportunity to really grow and develop strong relationships with each one of your patients. Some of them are extremely fast-paced, and you're moving through such a variety of patients and clients that you don't really get that opportunity. Well, this is one category in home health that really gives you that opportunity to grow those relationships with not only the clients, but also their families, and make sure that you are advocating for that person to their family in any situation that they may need. Now, one of the cons that I've seen is that you don't really get the full range of nursing in this type of home health nursing, meaning that sometimes you miss out on opportunities to grow and learn in depth of different skills and different things like that that you may not have any need to do when you're just in a personal care or companionship type nursing home health role. So what I mean by that is if you're in an ER or you're in surgery, you have the opportunity to deepen your skill set and your knowledge base in so many different areas, including some of the skills you do, injections and intubations and CPR training and what's new and what's happening. And sometimes in a personal care type home health situation, you don't really have the opportunity to do that. You're essentially working through the normal day-to-day routine with these clients, and the depth of nursing practice itself is sometimes not as deep as some would like. So take that into consideration when you're thinking about that particular type of home health nursing. The second type of home health nursing I want to talk about is in-home long-term care. Essentially what this is similar to long-term care that you'll see in a facility. It's just in the comfort of the client's home. So you'll be helping with activities of daily living again, but this time it's going to be more on a needs basis. So some of these clients may have trouble feeding themselves or changing clothes themselves. They're going to need help in those situations. And it's not just out of convenience, but out of necessity. Another thing that you'll be doing in these situations is you'll be taking regular vital signs, giving medications, potentially injections. In some cases, I have read there are a lot of cancer patients and things like that where there is long-term care in terms of at-home nursing happening with these patients. So some of the pros to this are a very, very low nurse-to-patient ratio. In almost every case, when you're in a long-term care type home health setting, you will be one-to-one with your patient. You'll be able to provide care and attention to one specific patient and one specific patient alone. You'll be able to really hone in on the needs of that patient, any changes, even if they're subtle with that patient, and you'll be able to truly care on a deep level with that one patient. You don't have to worry about having 4 or 5 patients at a time. You don't have to worry about as many acute situations, although there may be some. There's not as many as you might see in other fields. And again, you get to build that relationship. So because it's one-on-one and not, one nurse to 4 or 5 patients, you really have an opportunity to grow that relationship on the nurse to patient side of things. Now, one of the things that I've seen as feedback in the con category is essentially that there's not as much of a variety in this particular field of nursing. In the long-term care aspect of home health nursing, you don't usually see as much variety and as much change, which some people really enjoy. You do see burnout quite often in this particular position, just because it's such a long-term, in some cases, care for 1 to maybe even 2 patients on a weekly basis, that it really becomes easy to burn out, to just get you feel like you're in that monotony, even though you're still very much so caring for patients and they're very much so appreciative in most cases. There are times where it will feel like you're not really doing the things that you might feel like you want to, if that makes sense. But again, more pros than cons for sure. So one variation to the long-term care centered home health nursing is actually in-home skilled nursing. Now, it's very similar in terms of what you'll be doing, activities of daily living, helping people toilet, whatever the case may be. But one of the variations that you'll see with the skilled nursing side of it is that sometimes you'll have shorter term stays in each home, and you'll have more of a variety of patients. You may only be in one patient's home for a couple hours. It's possible that they can do most of the things on their own, but early in the morning they have trouble getting dressed and eating for the morning. Or perhaps they have trouble taking the correct medications in the morning and their family's concerned. So you'll still be doing more of the nursing, the clinical aspect of nursing, but it's on the skilled nursing side, so you still have that variety. So that's something to consider if you're looking into the long-term care side of home health nursing. All right, and the third category of home health nursing that I've seen is hospice care. So hospice care is essentially providing palliative or end-of-life care for patients in the comfort of their own home. One of the things that I've heard a lot from different patients and clients is essentially the fear that they don't want to die in a hospital. And although death is not a thing that we really enjoy talking about, it is something that we will all experience at some point in time, whether it's directly or indirectly. So hospice care nursing is a very special part of home health care nursing, in my opinion, because it allows people the opportunity to live out the rest of their life in the comfort of their own home. And for a lot of patients, that means living out the rest of their life with dignity and respect. A lot of patients that I've seen feel like you're taking their dignity and independence when they have to live out the rest of their life in a hospital, and they just don't want to do it. So hospice care nursing is a really good opportunity for those that have a lot of compassion for their patients to be able to provide incredible care for these patients that are already at the end of life. You have the opportunity truly to add value to their end of life. All right, guys, let's talk about the scheduling requirements. So one of the things that usually drive people towards home health nursing is that the scheduling is, in some cases, a lot more flexible than it is in the hospital setting. In the hospital setting, you are required to work a certain amount of hours. In emergency situations, you're required to come in. You have to cycle through holidays, etc. And in a home health nursing situation, you have a lot more flexibility there. So one of the areas you have flexibility in home health nursing is that you usually, depending on the company you actually work for, have the freedom to schedule your times with your clients at their convenience and at yours, which means that you can communicate and change schedules based on the need a lot more than you would be able to in other settings. So these shifts can range. They can be 4-hour short shifts that you have from patient to patient, and there's also 8, 10, and 12-hour shifts you'd have with each patient, depending on the type of home health that you're getting into. So always keep that into consideration when you're looking into home health nursing or the home health nursing field, is specifically the company that you're looking into, what type of care do they provide? Are they more so palliative care? Are they more so companion care? Are they more long-term care? Do they prefer you to have longer shifts in each home or shorter shifts in each home? Those are all things you're going to want to consider when you're looking into home health nursing. So one of the special considerations you may want to consider is that you may need special certifications for the position that you're looking into. So what you're going to want to do is talk to the companies that you're looking into and ask them specifically what type of patients they primarily care for and if you need any special certifications. For example, if you primarily take care of total care patients, which are patients that need 100% or close to 100% assistance in everything that they do, they could potentially have a tracheostomy, which is essentially a breathing tube that's entered into the trachea. But it takes specific care and specific training to be able to care for those outside the hospital setting. There's other certifications you may need depending on the age of your patient, on the client, or the disease itself. If you're giving them certain kind of medications, sometimes you need special certifications for that. So that is a consideration you're always going to want to make when you're looking into home health nursing, as there may be a large variety in the type of clients that you get to see. Another consideration you're going to want to think of if you're looking into home health nursing is travel. So in a lot of cases that I've seen, the travel is provided by the company, meaning that the vehicle you will use to move from location to location is provided by the home health company. But there are also a lot of situations where that company requires you to drive your own vehicle. Now, obviously, reimbursements are made for the use of your vehicle. Sometimes there are stipends that are given out because you're using your own vehicle. But in a lot of cases, you're still putting a lot of wear and tear on your vehicle, and you're going to want to consider that. Another thing I want you to make sure you're thinking of when you're talking about home health nursing is the patient ratio. So the patient ratio essentially in almost every case is 1-to-1. Now you may see multiple patients throughout the day, but very rarely will you care for more than one patient at a time. So you'll go to a home, you'll care for that patient, and if you have more than one patient in a day, you will go to that person's home and care for them. So you won't have to do it at the same time, which could be a pro for you, it could be a con for you. Some people like more fast-paced, more variety, and some people really enjoy that one-on-one time with their patient. And another thing I want you to consider is that in many cases, home health nurses are caring for the same patient or patients for a long period of time. Again, many people in nursing really enjoy the variety of nursing in some specific categories, and a lot of times you don't see that in home health nursing, which again, may be a pro for you, may be a con for you. If you really enjoy the variety, you're going to want to make sure that you work for a company that provides that type of variety as much as possible. And for some people, you absolutely don't want variety and you love that one-on-one time where you can build those strong relationships with your clients. and that may mean that that's an absolute pro for you. So the big question is, should you go into home health nursing? Well, the real question is, what are you looking for in the nursing field? Are you compassionate? Do you want to share a life with somebody? Do you want to have that one-on-one time where you are providing patient-centered care with focus and with drive? That's one of the things that you see a lot in home health nurses, is that one-on-one intensity of wanting to have that patient-centered care and advocate for your patients. If that's you, home health may absolutely be a great field for you to go into. And the other thing is, do you like to travel? In many cases, especially rural areas, home health nursing is some of the only ways that some people get care at all. So you may have the opportunity to travel distances and see new places and dig into different cultures and all kinds of different opportunities in home health nursing. Now, it is a little bit different than travel nursing, which we'll talk about in another video. Jumping back through this, guys, 2 years of a prerequisite program, 2 years in a nursing program. Now, once you have your registered nurse license, you can work as a home health nurse and expect to make about $65,000 a year. Now, that is dependent on where you live, so be sure to do the research on your specific state to see what you can expect for income. Now, after you start working as a home health nurse, there are a few different categories you can work in. You can work in a personal caregiving side of things, where you're spending more time with people on an individual basis and you're just kind of going through life with them, checking on them and being their advocate as they move forward. There's also the long-term care side of things, where you're providing nursing specific care to your patients depending on their needs. And then there's also a variation of that, which is essentially in-home skilled nursing, where you're going to be providing specific nursing care to potentially multiple patients. And there's also the hospice care. Providing value and adding value to people's end-of-life care is something that I think often gets neglected. So hospice home health nursing is a great opportunity to really add value while giving palliative care to not only the clients but also their families. Now, if you are a home health nurse or you have information about home health nursing that I didn't mention today, please feel free to mention it in the comments below. I think we'd all be interested in seeing it. So let us know what you do and or don't like about home health nursing. Don't forget to subscribe to the channel and hit the bell icon so that you're notified anytime that I post videos. If you have any questions at all, feel free to drop those in the comment box below and smash that like button if I've added any value for you today. I'm Joe, and I'll see you next time.